Hello, this is Basil Butcher Jr. again, your brain-based movement coach, and we're going to talk about the second in the series of overcoming back pain using the brain-based approach. Last week we spoke about pain, how you get pain, what causes pain, types of pain, the threat bucket. This week we're going to talk about sensory mismatch, which is a foundation concept in terms of brain-based approaches to creating solutions for pain conditions and detecting the cause of those pain conditions vis-a-vis an applied neurology or brain-based approach. The first thing we have to look at is what are the functions of the brain? The brain has two primary jobs. First one being survival, the second one being movement. Now we can think of the brain as a neural GPS, and the brain does a couple of things. It has three satellites: your eyes, which is the vision system, your inner ear or your vestibular system, and your proprioceptive system, which is your joints, your fascia, your muscles, tendons, ligaments, organs, etc. The brain gets information from those three systems, integrates it, and acts on it. That's how you move. That's what we would call, when all of those systems are telling the brain the same story, it's called sensory match. Now, how we come to sensory mismatch, it's when one or more of those systems are not on the same page and the brain is getting that information. It's a really hard time trying to integrate incomplete or not the same type of information, and then acting on it will cause situations of poor movement that can lead to pain and raising threat levels. And that's called sensory mismatch. Some really extreme cases of sensory mismatch are things like vertigo, motion sickness, nausea, where the brain is like, I don't know where you are, so I'm going to keep you sitting down or lying down because my primary job is for you to survive. Now, how we use that is, now someone comes to me, and they're talking about they have back pain. My first inkling is to figure out which one of these systems are not telling the brain the same thing. They're not on the same page. Which one is not? And there's several ways of assessing that. But let's say, for example, you're a person, you had a situation where your back is hurting you, but maybe several years ago and you didn't even know this. You maybe fell, or you were in an accident and you mild damage to your inner ear. So now your brain is getting information saying let's say it's your left inner ear. Your left inner ear is not functioning as well. And in the inner ear, there's two nerves in each one of them, a nerve in each one of them called the vestibulocochlear nerve. And based on the activity of that nerve, it tells the brain what position your head is in. So let's say, for example, it's the left ear, as we said earlier. So there's less activity. So that tells the brain is getting the signal. Because of that, your head is rotated right all the time. Now, in the hierarchy of the three satellites, or what we call the neural hierarchy, your vision system is 1, 2 is the vestibular, which is your inner ear, vestibular system, and your proprioceptive system is the lowest. So now, as a result, your head is turned, your brain tells your head is turned right all the time. Your body, your soft tissue musculoskeletal system is going to rotate or whatever to accommodate that, so you will be straight. What the brain thinks is straight. Now, that over a period of time can cause all kinds of range of motion issues and changes in your body that can lead to you having a pain situation in your back. It's often said that scoliosis is a condition as a result of vestibular problems. And so you can see how that can manifest. Now, you can go and have the best body work, chiropractic, and so on, straighten your back up and everything. However, your vestibular system issue has never been addressed. So what's going on is you're having biomechanical or body work stuff being done to you to alleviate a situation with your back, which has nothing to do with your body. The cause comes from a dysfunctional vestibular system. And that's how the brain-based approach would be able to detect that through assessments and so on, the function of your vestibular system, to tell them maybe that's not working well. That's one of the reasons why you have a back pain problem. I mean, another interesting thing, there are some systems called the vestibulospinal reflex. These are reflexes that there's a direct link between your vestibular system and your spine. And one is called the vestibulolateral reflex, and there's a medial one. So you can see how intimately related, say for example, your inner ear and your spine is. And so that is something I always want to check your vestibular system the minute I hear back pain, because I want to make sure those reflexes and so on are in working order. So I hope you enjoyed this video, and if you have any questions, you can comment or send me an email, and I will definitely answer the questions. And next week, the last in the series, I'm going to do some actual drills, generalized drills, because remember, this is always specific to individuals, but some generalized drills for your eyes, your inner ear, and your proprioceptive system, and which you can try to see if it will help you. If not, you can always call on me, and I will be able to help you. So until then, have a great week. Good day, good evening.